Hello students, this is Dr. Ways and welcome to your lecture on the gluteal region. So location-wise, the gluteal region is the posterior and lateral part uh, of the pelvis, the bony pelvis, and the femur. And so what we see here is the sacrum, the ilium, and ischium right here which would make up the bony parts of the pelvis, and then of course the head of the femur wrapped in its ligament for the hip joint, and then the rest of the femur right here. And what these arrows are showing you are outlets from the pelvic cavity through which various muscles, blood vessels, and nerves are going to exit and go to their component parts of the gluteal region, whether it be muscles or the skin. And so one thing I want to point out to you here is that here you've already gone through the hip bones and the different parts of it, and one of the things you saw was the greater sciatic notch. All right, and that's how you see it when you're looking at a skeleton in the laboratory. But in the actual body, it's called the greater sciatic foramen because the rest of it is filled in by ligaments that go from the sacrum to the posterior portion of the ilium, as well as to the ischium down here. And so this becomes a hole through which things pass instead of a notch that we see in the actual skeleton. So the muscles in this region are divided into three categories. You have your extensor muscle, and that is major one is going to be your gluteus maximus right here, which we refer to as our butt muscle or glutes. Deep to that, we'll have our abductors, which will take the leg away from the midline, and that's going to be our gluteus medius and gluteus minimus, which is directly underneath the gluteus medius here. And then we have our rotators, all right, our rotators. And what that's going to do is rotate the hip outward. So what you would do is see your thigh rotate in this direction. And those are going to be our piriformis muscle right here, our obturator internus, which is right here, our gemellus muscles, or gemelli, plural, as well as our quadricep femoris, which is right here. All right, so starting with the gluteus maximus here, our large glute muscle. Notice that it is attached to the posterior border of the ilium. And then it's going to be attached to the IT band as well as the posterior lateral aspect of the femur. And so when that muscle is contracted, if our hip is in a flexed position, it will straighten our leg out into extension, and then it will also extend our leg back beyond the line of our body into hyperextension. All right, and since it's partially on the lateral portion of the femur, as well as the IT band, it will also externally rotate our hip joint, our thigh at the hip joint. All right, so rotate outward. And its innervation then is the inferior gluteal nerve, which is coming from the sacral plexus with combinations or contributions from L5, S1, and S2. All right, our next muscle is not necessarily in the posterior part, but its connection is through the iliotibial band right here, and that's going to be our tensor fascia latae, or tensor fascia lata, which is this small muscle right here in the anterior lateral portion of the leg. And so notice its origin is the anterior portion of the iliac crest, as well as the ASIS. Its insertion is the IT band right here, and so when it pulls, imagine it contracting in this direction, it's going to flex the hip, so your hip is going to move upward in that direction, and also medial rotation of the thigh at the hip joint, so you will see your thigh go slightly in this direction, inward. All right. It is innervated by the superior gluteal nerve, which is part of the sacral plexus with contributions coming from L4, L5, and S1. All right, so now moving back to the posterior aspect of the gluteal region, looking at the deep gluteal muscles. So notice that we've cut away the gluteus maximus so that we can see all the muscles that are underneath it. The first is the piriformis right here. And notice that that is attached to the anterior surface of the sacrum and the greater trochanter of the femur. All right, so it's attached to the internal portion of the greater trochanter. So if we were to put our thigh into flexion so that the bone is actually in line with this muscle, and this pulls, our thigh is going to be pulled outward. So that would be lateral rotation of the thigh at the hip joint. All right, and its innervation is the nerve to the piriformis, which has contributions coming from S1 and S2. The other one is our obturator internus. Notice that that is right over the obturator foramen, all right, as well as that piece of connective tissue that covers the obturator foramen to the greater trochanter. So since it's going in the same spot that the piriformis would go to, it is also going to be involved in lateral rotation of the thigh at the hip joint. And its innervation is going to come from the nerve to the obturator internus and the superior gemellus, which is part of the ventral division of the sacral plexus, rather, specifically coming from L5 to S2, right? And the superior gemellus, basically the same thing as the rest of them. You're going to have the same action, and notice that it has the same innervation as the obturator internus. Continuing on, we have our gluteus medius and gluteus minimus, which both arise from approximately the same part on the gluteal region of the ilium, and going to the greater trochanter of the femur. So notice it goes to the lateral aspect of the greater trochanter of the femur. So when you contract these muscles, what you're going to do is have the thigh go outward. So it's going to be an abduction of the thigh at the hip joint. But it also, since it's more towards the anterior part of the thigh, especially the gluteus minimus, have some medial rotation of the hip joint, so an inward rotation of the thigh. Both of these are supplied or innervated by the superior gluteal nerve, which is part of the sacral plexus, just one step above the inferior gluteal nerve, with contributions coming from L4, L5, and S1. Then we have the inferior gemellus right here, which is going to take part in lateral rotation because it is its insertion is on the posterior aspect of the thigh, so it's going to rotate the thigh outward. And then the quadratus femoris, all right, which you see right here between the ischium and the medial aspect of the femur, the intertrochanteric crest, so the crest between the greater and lesser trochanters. And what it's going to do is also produce a lateral rotation. So it's going to, again, rotate that hip outward. And both of those, the inferior gemellus and the quadratus femoris, are supplied by the nerve that goes to those specific muscles, coming from L4 to S1. All right, so looking specifically at the gluteal nerves and where they're coursing, so notice that the superior gluteal nerve comes here through the greater sciatic foramen, just superior to the piriformis muscle, going to the gluteus medius and gluteus minimus, as well as the tensor fascia lata. We have the inferior gluteal nerve coming here, just inferior to the piriformis muscle from the greater sciatic foramen, and of course going to the gluteus maximus here. And then we see our nerve to obturator internus coming out here, nerve to quadratus femoris coming here, and our sciatic nerve coming down here, as well as our posterior cutaneous nerve of the thigh and perforating cutaneous nerve, which will go to the skin and allow sensations to happen in the gluteal region. As for the arterial supply that's giving these muscles oxygenated blood, here we have the abdominal aorta, the common iliac artery, then branching down into the external iliac and the internal iliac artery. We have the superior gluteal artery that's coming off of this internal iliac artery, going around out of the greater sciatic foramen, and the inferior gluteal artery, which is also going through the greater sciatic foramen and supplying the lower portions of the gluteal region with arterial blood. Notice also that veins are going to follow the same pathway and drain those regions as well. All right, just another view taking away all the muscles. We see the superior gluteal artery here, and we see the inferior gluteal artery here. And notice that they form anastomoses with other branching arteries that go around the hip joint, so that if there's any occlusion of blood, either due to a clot or due to pinching off, you are not losing a blood supply to that gluteal region, because there's going to be an alternate source.